Okay, it's good.
Okay, so we will be discussing a recent experience we all had at our clinical site that resonates with our 102 course and lab experience. We'll describe the experience and what our takeaways are from the experience and how we navigated the situation. So we'll just go through one by one and discuss our experience. I'll start. So I had an experience where a patient came into the ER who was physically attacked. The doctor ordered x-rays of his forearm and hand. He wasn't able to talk or really respond due to being under the influence, and he would moan when we moved his arm. So while we moved his arm and hand into certain positions, I had remembered from our course from doing the practicums with the second years that well, one of the second years had pretended like there was a knife in her wrist. So when I was trying to move her, she said, no, you can't move me. And she had me use critical thinking. So I figured that I had to angle the tube. So that's what we did with this patient. We had to get his arm in a certain position, and to get the lateral, we had to put the plate up against his body and angle the tube. So that's what my takeaway was. I kind of remembered how we had to do different positionings. And my takeaway was, as long as we understand the anatomy needed for the image, we can adjust the plate and angle the tube to get the proper images, regardless of the patient's limitations. And I navigated the situation by jumping in and just helping the tech start to position the patient. And it was nice to be able to be hands-on and use critical thinking in that moment. So that was my experience. Jessica, would you like to share yours?
My experience is that working in a hospital, there's going to be like new situations and just different situations every day, and in the ER especially. One particular one that really struck to me was a patient being intubated. Just going into that room, just you feel different emotions. They're intubated, so they have a lot of cables just connected to them. So it's just difficult to even want to touch them and position them. And some gurneys don't have they're not in trauma gurneys, which is different from a regular gurney, where you can actually put the plate under the gurney and not on them. So this patient in particular had they were intubated, but they were closed. They had their eyes closed, but we had to put the plate underneath below toward their neck, not to the side, just because the cables were all over them. So that was my experience. My takeaways was you need to be really cautious about the cables being near them, and you don't want to touch them or like get too close to them, because if you get too close to them, you might pull the cable when you don't want them since they're intubated. That was how I navigated my takeaways from the experience.
I can relate to that in the ER. Paul, would you like to share your experience?
Sure. So something that really got to me and that really was emotional for me was when I went up to the pediatric unit. Actually, I believe it was the neonatal unit, and there was a baby only about this big, and I was with my tech, and he was helping me out, and he showed me where it was. I went up and I saw the baby, and I looked at it, and it kind of was overwhelming. I couldn't believe, the size of this baby. I couldn't believe how a human being could be that big. So I didn't I told the tech I was with, I said, hey, I'm just gonna take a step back and I'm gonna let you do the x-ray for this one because, I can't, I couldn't really, it was a bit too much. And, also, though, my experience is with the geriatric patients, if they're in a bed or a gurney, and you have to take it, you want them to be upright for the chest positioning. But sometimes they're in a lot of pain, so they can't sit upright really. They can sit maybe 30 degrees or maybe 45 degrees up. And then, so in that situation, you have to take the portable and make sure that it's angled correctly. So so you get a good shot. And that can be frustrating because you don't really know the exact angle, and so you kind of have to eyeball it. But yeah, that was the past few weeks at the clinicals. Those are the things that stood out to me.
What was your takeaway?
So takeaway, so it's I kind of overthink things when I'm to the exam. So like when I'm looking at the patient, for a portable chest, yeah, I kind of think, okay, I'll say to the tech, what is the exact angle that I need to use? And they're like, well, there's no really exact angle. So my take from that is that sometimes you have to kind of, how do you say, you have to improvise. That's the word. You have to improvise a little bit. Use critical thinking to solve the problem of those exams.
Thank you for sharing. Lisa? did you wanna
Sure,
share?
yeah. So my experience that I was gonna talk about also took place in the ER. And it was a woman, an older woman who had come in and she had fallen. And so we were supposed to get like the femur and the pelvis, hip, and everything basically on the one side of her body. And she was vocally in a lot of pain. She had a lot to say. She was not excited about the plate going under her. It was pretty rough. It felt uncomfortable to me because the tech was saying the right things, but I didn't feel the genuine patient care. And then we proceeded to do the wrong leg. So then we had to do it all over again on the other side, which was, she hadn't sent them out and she was just like, this is why you always need to check. And we hadn't verified with the patient. So then we had to do it all over again. And she kept saying just one more, just one more. And finally the lady was like, honey, you have said that so many times. And so we were just at the door and I felt very uncomfortable. I navigated by being quiet. And then as soon as we could shoot, we would just shoot to kind of stay out of the way and get this process through, because we put that lady through, I felt like, a lot more than we should have. My main takeaway from that was how important patient care is, because these people are in so much pain and we're asking them to do some really uncomfortable things with a body part that's already hurting. We need to not be doing the wrong side. And then having a little genuine sympathy with them instead of just just one more, sorry, just one more. I felt uncomfortable just being there. So just try to help get it done as fast as possible and move on. I felt really bad for that lady. So also learned what not to do, because I don't want to come across that way when I am a tech.
And things aren't gonna be Meryl's way.
Nope.
People got hurt.
They sure aren't.
Yeah.
They sure aren't. Yeah, so that was it.
Thank you for sharing. Sure. Natalie, did you want to go next?
Yeah, so going along with what Lisa was saying, I believe it was the second week of our clinic, or start of school. So at this point, we were mostly observing the text. There was this patient who was in a lot of pain, and the tech was taking lower, lumbar spine images. But you could tell that the patient was in so much pain. It was so hard for her. The way the tech was handling the situation, it's like she didn't have any empathy towards the patient. She didn't really, she wasn't being careful. She was just moving and everything. She wasn't like, yeah, just being careful with the patient. And it's just,
It could be pretty rough.
it is, because it's like you can't do anything. All you're doing is just watching, and that's why I try to stay out of the way as much as possible so she could finish her exam. But then after she finished her exam, she's like, okay, you're good to go. The patient had put her foot bra back on, and you could just hear, because we were in the back of the window, and you could just hear her crying, and the tech was just like inputting like what's happening. And I couldn't just help myself just hearing her cry like that, and she probably needed help, so I went around and I was like, are you okay? Do you need help with anything? I'm trying to be as helpful as I can be, but she was like, no, it's okay, continue. She was continuing crying. She was saying that she was just in so much pain. And I told her, I was like, let me know if you need help or if you need anything. And she's like, yeah. But my takeaway is, again, like patient care is super important. Obviously, when I'm a tech, I would not handle a situation like that. I want to be caring and obviously helpful. We need to understand that these patients are in so much pain. And it's like, it's really hard, especially bending them in certain directions. It's just extra careful to do. And try to be as much as patients and less time.
That was kind of you to do that and to go ask her to take the extra time. That's why we're there. We're there for the patient. So to have them leaving, being so upset, defeating the purpose while we're there. I mean, we can't help their pain, but we don't want to make it worse. We can't help it. So that was nice of you.
Thank you.
Yeah.
Stephanie, would you mind going next?
Of course, a lot like what Lisa and Natalie said, it was for me, since I'm in the clinic, it's nothing crazy trauma-wise as of yet, but it's more so seeing how techs may not have the best patient care, at least in the sense of being empathetic and seeing someone's in pain. They're just kind of like getting their job done, which I understand you need to be time efficient, but you need to put yourself in their shoes that they don't want to be there. So kind of be in that position for them. But yesterday, very recent enough, it was a girl very close to my age. So I feel like it was already a similar person to kind of relate to, but not necessarily just a painful trauma, but an emotional trauma she went through. She told me she got assaulted, which already in that is very deep, very painful in a lot of ways just to go through that. Going through the actual images, it was okay. It was just a rib and chest, and doing the positioning was fine. But then she was asking questions that the tech, unfortunately, was the same one Natalie was talking about with the crying patient. I was also there for that. But she just told me like, okay, go send her away. And she was asking questions about like, is there a phone we could use, or she could use, but a personal phone. And when I was walking her back, she's like, I need to talk to you. She had me go, this is urgent care, so they had their own little rooms. She had me close the door and she was confiding into me. I don't know if it was just because she felt like she could, maybe because I was more empathetic to her rather than just image. I was like, I'm so sorry. Like, are you okay? I'm so sorry. Because there's not really much you can say in that position rather than just like being for the person as much as you can. And she said a lot to me that was definitely reportable, but she told me like, do not report anything. But obviously I didn't tell her I was going to. But then a doctor came in and was like, you're good to go. And all of her images, I heard the doctor say were fine. But then I went to the tech who took her images and I said what she said. Do I know if they're gonna report it? I'm not sure, because she really didn't care. She was like, what took you so long? But I was there being that for that person. Like, the images were done. They could continue taking images of other patients. I was just with that person as a person for that person or that patient. So it was hard because I have friends who've gone through things, personal experiences, it's just hard. So my takeaway is be empathetic, be for that person, because you might be the only person that they feel comfortable talking about stuff like that. And it just hit close. Be nice to patients. Yeah.
That's an intense situation to go through, and you navigated it well. And for you to tell the tech, I think, you know, that's the best thing to do. I think that's what I would do. For the tech, it's up to them, and you know, maybe take the next steps.
Yeah, I was telling her like, oh, like maybe like reach out to resources at the hospital or the clinic, like they definitely have things to prioritize patients, and she was just like, no, don't tell anyone, don't tell anyone. So she was having me like look up stuff on my personal phone, just about her phone and stuff, but I was trying to give her my personal advice while still being professional, because it was hard because she was my age and like just the situation she was in, it was kind of hard to still be in the barrel's way of everything, but it was difficult, but I did tell tech, so it's sure the tech would be able to help with me.
Thank you for sharing. Amy, would you mind going next?
Yeah, that one was deep. It's kind of hard to go after that.
Right.
Yeah, so, I had this situation actually yesterday. Luckily I was with the preceptor at the time. So it made it a little easier to navigate it. There was a man in the ER that, had an NG tube, which is the nasal tube, and we were there obviously to take the x-ray to see if it was, you know, where it should be. And it was really hard. So, I mean, the guy was great, even though he was in a lot of pain and you could tell. So we were just very careful putting the plate behind him because we needed the chest x-ray for him. So I mean, he really worked with us, which was great. But it was also very hard because when the doctor came in to look at where the line was, it was not in deep enough or correctly. And so it was like going down his throat, like scratching his throat and stuff. So it was pretty much choking him. So I was really glad that we were there right away. I think it was a stat, to help him, because sometimes the doctors and us, we don't really know how much pain they're really in. We can guess, but it was just relieving to like see the doctor and be like, we're taking it out, we're gonna put it back in. But he was in excruciating pain. It was like the noises and screams he was making, like they were all appropriate, shockingly, because I can't imagine having that done, and he was awake, like fully conscious. But he was like, you know, just screaming because it was hurting so bad, you know, and they had to take it out and then they had to put it back in. So it's like double the excruciating pain for him. So we just hung around to obviously make sure it was in correctly the second time. But it made me realize how essential our job really is, or what we're studying, and how important it is for the patients. But then, so they did get it in correctly. We took, you know, the x-ray, and he was actually very thankful to us. You know, when they got it in correctly, it was like pulling out like ounces upon ounces of fluid. And they were just like, you should not feel nauseous and stuff because it's like incorrectly. And he was just like shocked at how much was draining out of his throat and esophagus, and he was just like in shock, and they were like, you should start feeling better. So, you know, like before we left, you know, I usually try and just ask them how they're doing, make sure, you know, to say,
you know, not so much like have a great day because they're in a bed, but like, you know, you take care or something to try and, you know, let them know that we do really care. So we, you know, I said, now you take care, I don't remember what his name was, but Michael or whatever, he was like, you too. And he was really starting to feel better, so, that helped, but I mean, overall, he was a great patient. So there were no arguments there, but, yeah, you just really need to be there for them and, you know, help them the best way you can, even though you're not the doctor or the nurse, still like hear what they're saying, and make sure if they are asking something, you know, just grab the nurse or the doctor to help you answer it, because it's like limited sometimes what we can tell them. But yeah, it just took a lot away from it. Like you realize how much pain some of these people are in, and it's really sad. So you want to help them the best way you can to just not be in that pain. And I think he was just really relieved that they like, you know, figured it out, but we were also there to help them figure it out. It makes you feel good to know that you're like actually making them feel normal again.
Like the gratifying part of what
Yeah.
we're learning.
Yeah,
So,
yeah. So
Thank you for
That's a
sharing.
good one. Oh, that's a good one.
Casey, you want to go next?
So mine was more on the emotional aspect, and it was actually during a CT scan. We had a lady, she was about mid-30s, terminal cancer, no support system. She kind of opened up, so we had to do contrast for her for CT, so we couldn't really find her veins, and at that point, we called a nurse to kind of do it. The nurse came in, and she was kind of just trying to get her job done, wasn't really like sympathizing anything. It made her really uncomfortable. Like you could just tell her body language and you could see it in the patient's eyes. So the tech and I just stood by the table. She kind of opened up about her situation. No family, parents deceased, no kids, terminal cancer. So like it was hard to see because it's like she accepted it. So she was very like vibrant in a way, like the way she would carry herself. But you could see it in her eyes, like how deeply that hurt her. So, and she said, you know, she was just so used to it. She's like, I took a scan, another scan. Like to her, it was just like she kind of felt like a project or something to text the nurses, and that made me feel really bad. And when the nurse was trying to do her IV, the nurse was getting frustrated and just poking her everywhere, not trying to get that vein. And finally, I just grabbed her hand, and she like grabbed my hand, just trying to be a support system. And she would just look at me. And it's hard to say the right things to somebody who has terminal cancer. Like, you can't just, are you okay? You have to be careful what you ask them in a sense. So just trying to be like the most supportive I can. And after the exam, we usually walk our patients out. So I walked her out, and she just stopped me and she just thanked me because she said for the first time she didn't feel like just a patient. And that really got to me. And it's hard, like being in that field is hard. You have to separate like your emotional side and professional side, but at the same time, it's like you have to remember they're human. And what broke me is like she had no support system. So like to impact somebody in a way to finally feel like they were supportive. She had nobody, like no parents. So like chemo everything and going through it by herself, and she just felt like everyone would treat her like, okay, just get it done, get out. So that really touched me, and my takeaway is that it's like you really don't know what people are going through. Some people have no support system, and you just have to be empathetic, sympathetic, and remind yourself like you might not be in a position, but they're often trusting you in some way to just treat them as humans. And that's kind of, especially seeing it from other people or other techs that are like just want to get the job done, and there's more to it. Yeah, that was my experience.
say it.
I know.
Everybody had such good experience. to share. Wow, that had to be emotional.
It was, I went back and the tech and I looked at each other and we were just like, that was hard to see. She was so vibrant, but.
You probably made her day.
You probably did.
You
I went home that day and I was like, oh my god, that lady. Everybody goes through something different. That one was tough though. I was like, what do you say to that? It's so hard.
But now we all kind of know what we don't want to be, and you know, like, since it will be our career, like, it's something we have to remind ourselves of every day. Cause I think once you get in like the routine, a lot of people like just get annoyed or, you know, just like, they don't think about it. And so I think it's just like natural, like you were saying, like the nurse was just like, whatever, you know, like it's another patient. But she was showing that to the lady, which is something that we shouldn't be doing. So it's just like thinking about it, like future wise, like that we have to be consistent with patient care and make sure that you're doing the best you can for them, even if you're having a bad day or whatever the case may be.
Especially because we're like all taking, we're not taking, these patients aren't getting x-rays just for fun. They're not
No.
getting, but they're radiation just for fun. They're dealing with
Something's
something, like
wrong.
something's wrong. There's, something's wrong. So we just really
I think about like my family members. How would I want my mom or,
Yeah.
you know, my kids or just any family member to be treated? You want them to be treated well, and they're somebody's daughter, somebody's sister, brother, so good to treat them.
Sometimes people just don't have empathy. But it's
Yeah.
hard. It's like they just walk in and they have empathy.
It's hard, especially, you know, you don't know what to say or do. You feel, I mean, you're trying to help them with the x-ray, but like, as far as, you know, communication with the patient, sometimes it's better not to say anything at all. And sometimes you can't say some comforting words, but it all depends on the situation.
For the swallow study, and she was really nervous, and she just like put her hand out. And I just walked over and I just like held her hand, and that just, I guess, just being there with her helped her.
What she needed.
They're not saying anything or grabbing her. But thank you, everybody. This was a great discussion. I appreciate everybody's experiences. And we'll be back for the next discussion.
Sounds
good.
How do you stop this?
Maybe space bar.